Well, welcome everybody. I'm so excited. This is a small group, but this will be great. We can have some good conversations. My name is Dr. Kate Brennan. I'm really excited to be joined by two of my colleagues here from Children's, who I'll allow to introduce themselves in just a moment. But this is the Ask the Healthcare Provider event, and this is sponsored through the Pittsburgh Learning Collaborative and the Community Vaccine Collaborative. And really it's to answer and just have a conversation about anything that questions you may have about COVID or mitigation strategies, the vaccine rollout for youth that's coming, and just an opportunity to really get some good information in a smaller setting and have a conversation. So it will be pretty informal. So at any time, please feel free to ask any questions. This is a safe space, and there's no judgment at all about any questions or concerns you may have. We're just really excited that you're here and taking the time today. So with that, I'm going to turn it over to Maya and Jonathan, if you guys want to introduce yourselves, and then maybe we can just jump in.
Sure. Do you want to go first?
So Dr. Brennan, thanks so much. Dr. Maya, thank you as well. Again, my name is Jonathan. I work for Pitt in the Department of Family and Community Medicine, and I'm excited to be here. So happy to answer any questions that you guys have or just participate in a casual discussion.
Great, thanks so much. And my name is Maya. I'm a pediatrician also at Pitt, and I'm also part of the Community Vaccine Collaborative that Dr. Brennan was talking about, where we are a group of community-based organizations and healthcare providers and researchers that are working together to promote COVID-19 vaccine equity. And so also happy to answer any questions at all you may have about anything related to the vaccine or anything COVID related, or if you want to ask other questions as well, that's fine. But usually we just, with these events, we just like to make it really informal. So I don't know if anyone has a question and we can just jump in.
Dr. Ragavan, maybe giving to start some just kind of like where we are with vaccines and some of the mitigation strategies for schools that you've been hearing about, just to kind of level set for people, and then maybe that'll spark some questions.
Yeah, sure. And then I'll say a couple things and then turn it over to my colleague. Yeah, so I mean, where we are with vaccines right now is that vaccines are available, very available for young people 12 and up, and for adults. We are very hopeful that imminently the vaccine will be available for children 5 to 11. It's not right now, but very hopeful that it will be soon. And then for the littler kids, it may take a little bit more time, but certainly hopeful that that'll happen as well. And so the vaccine is available all over the place if you're 12 and up, at your pediatrician's office, at pharmacies, really anywhere. If you are having any difficulty getting vaccinated, please let me know, and one of us can help you with that. And then in terms of school, I think the biggest thing, like my biggest message, is just mask wearing. That is the most important thing that can be very, very important in preventing the transmission of COVID. So just wearing that for children, wearing masks, for teachers wearing masks, and just really all of us, I think that's really important. But I'll turn it over, Jonathan. I don't know if you have anything else you wanted to add.
I don't have much to add. I think it was well said. Maybe just to echo that last point, I think masks and vaccines combined are really the best tools that we have to hopefully put this in the past.
Just want to open it up to any questions now. We can, like I said, very informal. But if there's any, oh yeah, yep, absolutely. You can type in your questions. Thank you so much. And I'm so sorry about your laryngitis. So we do have a question in the chat. And what morbidity issues are you seeing in previously healthy children? And then as a follow-up question there, any long-term issues? And if anybody would like to ask questions in the chat, please just feel free to add those in. And if anybody is just new to the room and does require any translation services, if you can put your preferred language in the chat. So Dr. Meyer, Dr. Jonathan, any, do you want to kind of start out with the what more morbidity issues are you seeing in previously healthy children?
So sure, I can start out with this one, and then Dr. R, maybe if you want to share your experience as well. I think that there has been a change with this Delta variant. I think we are seeing it affect children more than we did with the original strain of the coronavirus. Globally, in terms of long-term issues, the first thing that comes to mind is what we're calling long COVID, some fatigue, lingering brain fog, even aches and pains. While this isn't as common in our younger patients, I think it's certainly a possibility.
Yeah, I think it's a great question, and I just well, I agree that we definitely have been seeing that. A lot of children recover very nicely, after COVID. They get COVID, they get better. But I think it's also, it's absolutely, possible for the symptoms to linger a little bit. The one other thing I'll mention is a lot of parents have been asking me about when their children can safely return to activities like sports. And so usually, the recommendations right now are to wait at least a week after the first symptom, the last symptom. So after the last symptom resolves, not including the loss of taste and smell, which can take a little bit longer to resolve. So you wait a week after that, and then depending on how severe the infection was, you can either, if it was kind of like a more milder infection, there's a sort of a gradual return to activities. And if it was a more severe infection, sometimes children will have to see the cardiologist and get an electrocardiogram and EKG before returning, but that's only really if it was severe. And so if you have any questions about that, ask your child's pediatrician and we can help you with that. We can also, write notes for school about how children should go back to activities. So yeah, that's just another thing to add. But definitely, some people are having like the long COVID or long haul COVID. And so if you're worried that your child isn't recovering fast enough, or if you know someone who has, a child who has COVID and not recovering fast enough, I just would recommend to talk to your pediatrician so we can just make sure everything is okay.
Thank you both so much for that. Another question in the chat is the mu more dangerous than Delta? And this is coming from one of the children who Alejandra works with.
You know what? I personally don't know very much about mu. I will defer to Dr. Jonathan, but we can definitely ask some of our infectious disease doctors, but I will defer to you to see if you do. I know that's just coming up now.
So no, I think my response is similar, that we should try to get you some more reliable and robust information. I am tempted to say that we don't know as a society just yet because we don't have a lot of information about this variant. When I first read about it, I was very interested and somewhat concerned. And so I don't know. I think if you guys have some concern, I'm with you. And yeah, maybe we can just try to get some better information about mu and get back to you.
Thank you. How about distinguishing between, this is kind of allergy and cold season for kids, and it's pretty typical, right, for children to experience the common cold. At what point, docs, do you think that parents should be taking their child to get a COVID test or to be quarantining? I mean, what's the big differentiator here?
I don't know, Maya, if you want to trade off who goes first. I'm sorry. I certainly don't need to talk first every time if you want to take the lead on this. You sure? Okay. So this is a really good question, and I think allergy season has at times coincided with when we've seen a rise in cases. So the calculus for me all relates to what we are trying to do at the end of the day, and that's we're trying to keep people safe, and we're trying to reduce the spread. So I think if it's possible, and if it's not terribly disruptive to someone's day-to-day routine, to try and stay masked, try and stay socially distanced is always a good idea. In terms of testing, the way I talk to my patients and families is that if they feel that there's really a discrete illness, if there's been a change, and if they feel like they may be getting sick, I think it's a good idea to test. If testing is not feasible, or if they can't get to the testing center, I think then we go back to the original goal, which is just to keep people safe, to maybe even assume that you have it, and to try to stay distanced from everyone else. Does that kind of make sense? I think that's my approach.
Yeah, I totally agree. I think with allergies also, so usually, I mean, COVID is difficult because there are so many symptoms that can come with COVID. It's not just congestion, it's not just cough, it's not just sore throat, it can be so many different things. But one of the things with allergies is usually itching, and not always, by the way, but like nasal itching, eye itching. And so when I have patients tell me that it seems like they're regular allergies, they have a history of allergies, they have a lot of itching and discomfort, and something like Claritin or Zyrtec, depending on what your doctor has prescribed for you, makes it better. That makes me feel like it's more like allergies. But if it's like a new type of thing, if they haven't had allergies before, it's not very itchy, it's more kind of they're not feeling well, I would just get tested, and if you can, and really just be safe. I think with COVID, if you ever feel like you should get tested, you should. It's better to know. And I think, I want to just acknowledge though how hard it can be sometimes to get tested. I mean, it's not always the easiest thing, but there are websites where you can look up places in your community. You can go to your pediatrician's office. But I think if you are thinking about if you should get tested, you probably should. If it feels like your regular allergies, your allergy medicine makes it better, you have a history of allergies, you could probably, see how you feel with allergy medicine. That would be my recommendation.
Thank you both so much. How about in terms of the vaccine for kids? So I think I've heard some concerns among parents saying that their concern is that the effects from the vaccine are going to be worse than their child getting COVID. What would your response be to that?
I can start an answer and then pass it over. So I think that my response as a pediatrician who vaccinates children all the time, that's what we do, that's a big part of our job, is that is I totally understand where they're coming from, but the side effects of the COVID vaccine are for the most part very mild. They last for a very short amount of time, and while you potentially as a child could get COVID and not have any symptoms, you also could get COVID and get really sick. You could get COVID and spread it to somebody else who could get really sick. And so getting vaccinated is the safest way to protect yourself and protect your loved ones and your community. And the side effects of the vaccine are like I said, mild, and can be a little bit of Tylenol or ibuprofen if you're feeling that way, as long as it's safe for your child to take those medicines, can be very helpful. So I would say, even though it's possible that yes, they may have some side effects, you don't want to take chances with COVID. You just don't want to take chances with COVID. So yeah.
So I, of course, agree, but I find this to be a really challenging issue. And anytime I'm faced with a question like this, I think I try to make it as specific a response as possible, to really understand where someone's coming from, whether they feel anxious, fearful, suspicious. But in general, I agree 100%. One of the trickiest things about this virus in particular is what we would call the asymptomatic contagion. There is just such a high percentage of people that have it, have no or such mild symptoms that they don't even think about it, and they can still pass it on. So I think there is some validity to these parents' concerns, saying that, hey, maybe the vaccine is going to make my child's arms sore when they would not even know that they have COVID. So I guess I would try and validate that. But if I could, I would make a plea for the greater good, for the role that we all play in kind of at beating this and putting it in the past. Because I think if we are vaccinated and if we can deal with a day or two of sore arm or some body aches, maybe even some low-grade fevers, that may reduce the risk that we get it, have an asymptomatic infection, and heaven forbid pass it to someone who's really high risk and could really get hurt from the disease.
Thank you. The next question that we have are, can people such as unvaccinated children be less than 6 feet apart if they are outside?
So Maya, is it okay if I start this one off? I think this is a great question. And as a physician, I think for me, it really comes back to risk. If you are closer to someone, if you are indoors and closer to someone, your risk is higher. I think if a room is well ventilated, if you're really far apart, if all are vaccinated, and say if you're outside, I think your risk is much lower. So specifically, less than 6 feet apart outside, my answer would probably be kind of in with respect to various risk categories. I would say that's lower risk. Dr. Meyer, what are your thoughts on that one?
I totally agree. I totally agree. I mean, there's some logistical issues. Like, I don't think it's kind of hard to wrangle a 2-year-old to stay 6 feet away from you. But I think for the most part, as much as, I mean, this is all about as much as you can. So, you know, physical distancing is very helpful in preventing the transmission of COVID. And if you can't do that because, you have a 2-year-old that wants to give you a hug, and they're not going to stay 6 feet away from you, then, masking. I think it's like, we say something, it's called like a Swiss cheese model, right? So like the more you do, like you may not be able to do all of these things, but the more you do, the more protected you can keep yourselves. So vaccines, masking, physical distancing, hand washing, all these things are really important, and they sort of layer on top of each other to provide protection. And so I don't want people to feel like guilty if they can't stay, you can't stay physically distanced from your own unvaccinated child. Like I obviously cannot stay physically distanced from my 2.5-year-old son who needs me to take care of him. But I think, making sure that, like I got vaccinated right away. My husband, everyone that can get vaccinated, my family got, vaccinated. We always wear masks when we are seeing anyone other than sort of the immediate people in my family. And so things like that, I think, are really important.
Thank you both.
But before we move on, can we get some feedback on our answer to that question? I think just hearing both of us talk, I wish we were able to give a binary yes or no answer, but it's really hard to do that. Are you guys able to give us some feedback on how that response was received? Was that okay?
Yeah, it was helpful. Thank you.
Okay, thanks. I
think one of the big questions also that some people have is when they're outside, especially now that they're trying to leave the children to do their sport activities, it seems that there is a tendency to, when the coaches, sometimes they put them very together to speak at the end of the, for example, cross country. So there is a little bit of a concern there, how okay is to bring the children together at the end of a cross country competition, if they're outside or not, for example, or if there is an event like parents want to get together and they want to have some party, and they do it outside, but it's still how much yeah, they should be using or not using the mask when if they are vaccinated, but the other children are not vaccinated. So it's that kind of like socialization, but also understanding that still we have the COVID issue for those that are not vaccinated, especially.
And I think that's a great question, Alejandra. And I mean, to me, like, yes to wearing a mask, like just yes. The answer is always yes. And I know that, I know it's hard. I think it's hard. But I think like in the situation you just provided, like if there's a group of parents and kids meeting after like a cross-country tournament, I definitely think everyone should wear a mask, because I think it's actually groups like that, if someone doesn't wear a mask and they have an exposure to COVID, like that's how I think it's spreading. So I definitely think yes to mask wearing, recognizing how challenging it is, right? And recognizing that it can be hard, but I think to me, like the answer to mask wearing is always yes. I just think that, right, is the key right now that everyone, needs to do that, and vaccines. But Jonathan, any?
No, I agree. Masks, vaccines, and where you can choose, I think there are certain ways to choose safety. If you can't do 6 feet, if you can do 3 feet, if you can do it outside when you have a choice, I think all of those things make it safer. But otherwise, no, I agree completely.
And I think it's important. One of the things, like as a parent, sometimes like you just have to follow your gut, right? Follow your instinct. Like if there's an activity that the kid is, that you want your kid to do, but people aren't wearing masks. Like, you just have to, like, I think there's a piece of it where you just have to trust your gut as well. But I think for the most part, if it's really just about whoever can get vaccinated needs to get vaccinated, and everyone needs to wear a mask. So
the complicated part of this is just like here, at least in our area in Westmoreland, it's becoming almost a norm to not wear a mask if they are in the outdoors. So now how you change that, like, belief that it's all okay outside, it's another challenge.
This is a huge challenge, and if you figure this one out, please tell the group, because I find personally, as not just as a physician, but as a member of this society, I find it exhausting to have this conversation with strangers. Oh, why are you wearing it? You don't need to wear it. COVID is not real. It's I think we've all been saying these things, and it's depending on where you are, it's hard. Many of our neighbors don't feel the way that we feel.
Thank you all so much. Next question is, have you seen an increase in MIS-C with rising cases in our area? And is a certain age group more at risk for it?
So for this one, I will totally pass it off to Dr. Raghavan. As an attending, I actually don't round at children's anymore, and so I'm not the right person to comment on this. I apologize.
Yeah, no, absolutely. It's a great, I was actually trying to see if there had been any recent studies published on any recent rises of MIS-C. So in general, it remains very rare. I think that's really important. It is a rare sequelae or side effect or condition that happens with COVID. For those of you that, just to kind of explain what it is something that happens in children where they have many sort of organ systems impacted, and they just generally because of elevated inflammation. And so I think the most important thing with this, so it can happen, it happens a lot. So I think the most common age groups are like the less than 10. So, you know, the 0 to 5 and the 6 to 10. I think the most important thing is if your child has COVID, or if you know someone whose child has COVID and they are getting sick, right? Because I think this is really important, because so much of what we tell you is if you have COVID, you need to isolate. You need to isolate, and you should. But if they are getting sick, if you feel like their heart rate is high, if their fevers are not getting better, if they are saying that they're dizzy and they're not able to drink and eat well, they need to be seen by a doctor. And we really want to make sure that nobody is sitting at home getting really sick with COVID because they don't think they should come in. Definitely, you know, let people know that your child has COVID. We will wear the protective equipment we need to wear, but it is our duty and responsibility to see you if you are sick, and we all will. That is an important part of our job. And so I want to just make the point that if you have a child, or you know a child that is getting sick with COVID, really sick, please let us know, because it is rare, but it happens, and we want to make sure that, you know, if you catch it early, then we can help children recover from it. But I just wanted to make that point. So I think the biggest thing to look out for is if you have, you know, if your child is getting sick, or if you know a child who's getting sick, to just let your pediatrician know. That's really important. Thank you. It's a really good question.
Dr. Jonathan, did you want to add anything? I saw you unmuted.
Sorry, definitely on the fence, but I think as a generalist, as just a general practitioner, I will add that this is a scary disease, MIS-C, but I would still consider it very treatable. These children, they need help from a lot of different medical specialties. They are occasionally admitted to the pediatric ICU, but we have a lot of experience with similar diseases, if that makes any sense. And I think a lot of these kids respond to our therapies. They get better. So just like Dr. Maya was saying, this is, if there are concerns about this, it's not a good time to stay at home. Come on in, get checked out. We can connect you to care. And a lot of these kids respond really well.
Sorry, and I've just put some information about MIS-C in the chat from the American Academy of Pediatrics. If you guys, it has some symptoms you should look out for and things like that. So I just wanted to put it in there. But yep, totally agree.
Wonderful, thank you. And we did have someone just join us. So if you would like to ask any questions, please feel free just to unmute yourself, or you're welcome to put them in the chat. Excuse me.
Hey everyone, this is Goddess Jazz. I am here just to see what's going on and see if I have any questions and just see what you guys are talking about. Sorry for my tardiness. My pit is 100 pounds and he wasn't trying to hear me coming in from work on a walk. So I apologize for my tardiness in advance.
Thank you so much for being here. Please feel free to put any questions in the chat, like I said, or unmute at any time. Next question we have here is, why are general doctors not providing the COVID-19 vaccine?
So if it's okay, I can share my my personal experience with this question and this problem. I work at a small health center in the Hill District, and at the beginning of the pandemic, this was not even an option, I think, for a couple reasons. One, especially with the Pfizer vaccine, was the refrigeration requirements. You needed specialized equipment to keep it very, very cold. I think another complicating issue was that we anticipated vaccinating massive numbers of people. So facilities like Heinz Field or the Peterson Event Center were better early on. But at this point in the pandemic, we are starting to talk about this with our managers, and we're trying to figure out how to do it, how to keep these vaccines cold so that they don't spoil and that all procedures are followed, and so that we can vaccinate and give booster shots to a reasonable number of people. So I think this is changing, and I think the health system is adapting to do this.
Thank you so much. The next question is, if multiple people in the family have tested negative for COVID, should all family members get tested? and they provide a little bit more
Yeah.
context here. So
Yeah, I sort of read through it. It's a really, really good question. Here's my general advice. If you are symptomatic, meaning you have a COVID type symptom, I recommend getting tested. Now, if let's say this happens to me all the time, I have a 2.5-year-old and he comes home with like a little cold, and then everyone in my family has a little cold, and one of us is test negative. Some people have asked, well, does everyone really need to? I think the safest thing is for everybody to test, to get COVID testing. But if 2 people in the family have tested negative and everybody's symptoms are the same, I think it's okay. But remember that, I mean, it's COVID is really tricky because symptoms are very different. And so I think it makes sense as a general rule of thumb, if somebody has a symptom that could potentially be related to COVID, to get tested. Now, if you're asymptomatic, meaning you have no symptoms, and you were exposed to somebody who is COVID positive, my recommendation is to talk to your doctor, but my recommendation is actually to wait and to quarantine and get tested on day 5. Because the CDC is saying that if you get tested, the Centers for Disease Control is saying if you get tested on day 5 after the exposure, and you're negative, you can actually break your quarantine a little early. Now that is a little tricky if you live with a person who has COVID, because then you're kind of exposed every day. So that day 5 only is after they finish their 10 days. But that would be my recommendation. So my rule of thumb recommendation is if you're symptomatic, get tested. And if you're asymptomatic, wait until 5 days after the last exposure. I don't know, that's kind of a sort of just a simple rule of thumb. I don't know, Jonathan, what you think.
Nope, I agree. That I don't think I could make that response any better if I tried, so I won't.
thank you. What can you do if somebody has COVID-19 symptoms? Is there any medicine that could be provided to the person who may get sick with COVID?
So I actually have one really exciting medication that I love to talk about. Guys, please stop me if I go on for too long. But for a few months now, we have had this special therapy available here in southwestern PA. They are monoclonal antibodies. They are given via infusion, via an IV right into the vein. And I essentially think about these medications as if they're a COVID vacuum cleaner that just goes right into the blood. At the beginning of kind of our available use period, we were only using these medications for people that got sick. But at this point, we also think that they're really helpful if you were exposed, to ask your doctor if you can get it and maybe even prevent yourself from getting sick. So in terms of preventative, let me just make sure I'm understanding the question right. Was it preventative? I think that would be my my number one medication to mention.
Yeah, I agree. I think I'll say that one of the things, and sorry, I was pulled away for a second, so I'm so sorry if you mentioned this, but one of the things is monoclonal antibodies work like better the sooner you present for care. So I think that's the one thing would be to kind of, if that's something that your doctor thinks makes sense for you, then just to ask your doctor for a referral like sooner rather than later. And I also just want to add, of course, to this, just because, we'll just keep saying the same thing. I think masks are, maybe they're not like a pill, but they're great medicine in prevention. I just have to keep saying it over and over again. And vaccines as well. I mean, those are the preventative. The monoclonal antibodies are if someone already has COVID, but to prevent it, just masks and vaccine. But yeah, I don't have anything else to add about monoclonal antibodies. And I am going to, for the next question, totally defer to you, Jonathan, because I don't know anything about adult medicine. So
no, that's okay. Actually, before we move on, Dr. B, are Dr. Maya and myself allowed to ask questions of the group?
Yeah, you certainly are.
I feel like maybe the question of preventing COVID or kind of outpatient treatment of COVID is one that maybe we could dive into. I feel like there's a ton of stuff in the misinformation category about this that you may see in the news or hear on a podcast? I don't know. Does anybody have any specific medications that they want to ask about or talk about? I guess the one that comes to mind for me is ivermectin. You always hear about ivermectin. Does anybody out there have any other thoughts about prevention or treatment that we can go into in more detail?
I know that I have heard about some of the members of the community about this kind of like very similar the way that some people do it with a cold. They just put vapor and they put these leaves like eucalyptus leaves, and they have these like sort of breathe the vapor and sort of kind of like in order to get some kind of decongested. I think that a lot of people it's looking to COVID in a very similar way that like they see the flu. So they mainly try to maybe to mitigate some of the very beginning, how to say, symptoms, like almost treating a cold. And I just wanted to hear from you your thoughts, and if there is such a and even in the media and the social media, I have seen some of those recommendations of doing this kind of like vapor sort of like breathing, you know, like kind of similar that kind of like the cold that they put something in your chest and kind of like sort of like to open up the channels for better breathing.
So I think that's a great point. I think we would characterize those kinds of treatments as something that we call symptomatic management, of maybe not addressing the virus specifically, but trying to make the symptoms less uncomfortable. And the vaporizer or even a Vicks Vapor Rub or something to help with decongestion, I think that's a great idea. With certain very young children, we don't routinely recommend cough suppressants, especially no honey for kids under 1. But for young adults and adults, I think all the things you mentioned, if they help with symptoms, are a really good idea.
I just want to reiterate that one point that you made, which is for children, I do not recommend any over-the-counter medicine. So no Dayquil, no NyQuil, no Robitussin, no whatever else there is. First, because, well, just a couple things. The first is because some of those medicines actually have Tylenol or other components. And so sometimes people unknowingly will give both NyQuil and Tylenol, and then that ends up being too much Tylenol and it can affect the child's liver. Some of those medicines also have aspirin in them, which no child should have. It's not safe for children. And then also a lot of those medicines don't actually work very well for symptom management. There's really no evidence to show that Robitussin works for helping prevent coughs for these sort of viral infections. So my rule of thumb is no over-the-counter medicines. If you need any help about that, just ask your child's pediatrician. But I just wanted to reiterate that point. I think honey can be really helpful as long as one or older. No honey for children under 1 because of the concern for botulism. But honey is actually helpful, and there's actually research that shows that it can help with congestion and cough. Another thing that this comes from, actually there's research starting on this, but it also comes from ancestral knowledge, is turmeric. So a lot of people in the Indian community use turmeric and honey. Again, I wouldn't use that for little kids, infants, but for older children, adults, turmeric can be very helpful in helping with congestion. But all of these are definitely symptom management. And if you are sick with COVID, I definitely recommend, to see if you're eligible for the monoclonal antibodies, because that can help as well. But yeah, those are great points for kind of how to help with some of these symptoms. But at the end of the day, really the most important thing is that your immune system fights the infection, which is why vaccines are so helpful, because what vaccines do is they give your immune system a heads up. They create the specialized part of the immune system. So as soon as your body sees COVID, if it sees COVID, they can fight the infection right away and get rid of it, and before you even get sick. And that's what's so great about the vaccines, because I think the most important piece of all of this with something like COVID is that your immune system sort of fights the virus. And so yeah.
So I'm not sure if we need to go on record and say it, but just at least as of right now, as of all the evidence that we have available, ivermectin, hydroxychloroquine, azithromycin, household bleach, not recommended to treat or prevent.
Thank you. What about for vaccines? Just some feedback that I've received is, if my child had the flu shot, do they really need to get the COVID vaccine also? Can you talk a little bit about just how those two vaccines, the flu shot and the COVID vaccine for kids, works differently, and why it's important for folks to get both of those this year?
Absolutely. I think that's a wonderful question. Whenever we get sick, it is, and it's caused by a virus, there are so many different viruses that can do it. Typically in practice, myself and Dr. Meyer, we may not even identify which one. Sometimes we don't have a test to say exactly what virus does it. But to that point, influenza and COVID-19 are caused by very different viruses, and a person can get both at the same time or in the same season. So the flu vaccine and the COVID vaccine, both, they actually prevent different diseases and they serve different roles. And as of the latest recommendations from Dr. Fauci and his team, they can be given at the same time. So COVID vaccine and flu shots can be administered at the same time.
It's kind of like, I totally agree. It's kind of like when people ask, why does my child need so many vaccines for kind of their regular vaccines? And it's because every single one of those vaccines is treating or preventing, a different type of disease. And not every disease out there has a vaccine, but the ones that do, they all need to be given in order to prevent all those different kinds of vaccines. There's a reason we don't see polio. Actually, I always share this story that my aunt has polio, my uncle has polio, my dad actually had it, but didn't have any long-term sequelae from it, thankfully. But my aunt and uncle both have polio or had polio, and they're doing incredibly well. But people say, oh, we don't see polio anymore. Well, I see polio. I've seen it. And they were born in India and didn't get vaccinated. And so I think it's so similar. The reason we are not seeing these things is because of the vaccine. And I think we can get there with COVID too. And I totally understand how stressful it is to make decisions about your child's health. But I want to just mention that as just an example of something that, we don't see because of vaccines. And it's really wonderful because polio is a really, really horrible disease that really is very impactful on people's lives. And so I just wanted to share that as an example.
Thank you. We have about 14 or so minutes left. So I just wanted to pause and see if there are any other COVID specific questions as it relates to youth or mitigation or otherwise. How do we encourage getting the vaccine?
All right, so I'm gonna ask some questions.
Oh, sorry, excuse me, just 1 second. We had a question in the chat. How do we encourage getting the vaccine without being ignorant to the inaccessibility of vaccine distribution for certain communities?
Yeah, that's a great question. Dupreen, am I pronouncing your name right?
Yes, you are.
Dupreen, I see your question in the chat, and so I don't want you to think we're ignoring it. I don't know how helpful we can be with specific medical questions, but I think we can definitely. I don't know, Jonathan, if you wanted to answer that one, and then we could jump into that one. I just don't want. I definitely see your question right there. But I'll defer.
Yeah, I
I'll
do it
defer
in
to my
there.
colleague.
Any other questions for the doctor? So I just do that in there.
I just didn't want you.
Yeah,
I see your question right there, so I'll defer to Jonathan to answer.
Yeah, we can definitely touch on that real quick. I do think that in terms of individual medical advice, I think we should probably encourage you to connect with your medical provider that knows you really well. What I will say about Effexor is that if you stop it abruptly, you can have what we would call a discontinuation syndrome, where you may feel really jittery and shaky, have headaches, and some people feel really crummy if they stop it abruptly. So I would say, as you mentioned, that it be a wean or a taper that you talk with your doctor about. Goddess Juice, does that help for now? Is that okay for now?
Yes, that's very helpful. Thank
Awesome. And then just Sophie, for your question, so I'll start with an answer. It's a great question. It's a big question. So one of the things that we've been doing with the Community Vaccine Collaborative is really kind of asking for community input on how to distribute the vaccine in ways that are accessible. And so I think it's a multi-level answer. I think for the most part, I think that it's very important that the vaccine is available in different spaces, in different ways. And so, I think it's important that it's available at these mass vaccine clinics where people can like walk out the door and get the vaccine. I think it's important that it's available at people's place of employment, because a lot of times people can't take time off of work to get vaccinated. I think that it's really important that the vaccine clinics are language equitable, so folks that don't speak English are able to access them. And so I think it's really using like all different kinds of strategies to make sure that everyone can get the vaccine in a way that makes sense for them. I think it's also really important that it's available on the weekends and things like that. So we've tried, there's different things right now, like you can get it at a pharmacy, we still have a lot of these community-based clinics, school-based clinics. You can get, like we have it at our clinic right now. So like the kids can get it at our, at our pediatric clinic. But I think it's really, I totally agree with you. And I think it's not just about getting the vaccine, it's about registering to get the vaccine, getting an appointment. I mean, the way that it works now is it's very, you have to have technology access, right? You have to be able to like register online. So I think the more options we give, the better. That is the beginning of an answer to your very important question.
Yeah, I agree. And the only thing I will add is by familiarizing with yourself with the availability in different communities, what goes into it, I think that's the best way that we can be informed, be helpful when we're talking to people that may be interested.
And then we have one more question in the chat, and then Dupreen has a question. Brandy was just wondering, and we covered this a bit already, but I just would like to, if we can quickly review again, just when should we keep our kids home from school? If they have sniffles or a cough or sore throat, and at what point do you decide I really need to keep the kids home?
So this is tough, and I think earlier when we talked about it, I don't know if we had a hard and fast answer. Maybe the only definite answer we have is reach out if you have questions, because you can talk to your doctor, your pediatrician about this, and they can help you through it. I think my 2 cents today is that if it really feels like a period of discrete illness, like there is a change and maybe someone is getting sick, it's a good idea to think that it could be COVID, and to think about getting tested and think about isolating. Dr. Meyer, you had a really great adage about allergies, and I won't try to steal it, but I thought your point about allergies was very good.
Oh no, you can repeat it. Yeah, I totally agree with that. I think with the specific question about allergies, so I think if whatever you're experiencing feels like your normal allergies, and you have like itching, and because that's a huge piece of allergies. Well, not always, but often. And if you take whatever allergy medicine you usually have, like if your child is on Zyrtec or Claritin or something like that, and they get better, then I think you can be more comfortable thinking, hey, it's allergies. But I mean, I actually had a family the other day who was saying, oh, it's, I think my child has allergies, but this child never had allergies before, and was also just feeling kind of under the weather. And I was like, you know what, it could be allergies, but let's just do a COVID test just to be sure as well. So that's why calling to your pediatrician's office is helpful. The one thing I'll say, so, and actually, Kate will kind of want to hear what you say about this too, and defer to you, but many schools and daycares have pretty set rules of when kids can come in. And oftentimes, I will say sometimes, I mean, they are, as they should be, fairly comprehensive. And so, you know, I think you could talk with your school too, like, you know, with what those rules are. But I think just ballpark, you know, fevers, anything above 100.4, you should definitely keep your kid at home, 100%. Vomiting, not being able to eat and drink well. And if your kid is saying that they're just feeling really run down, like it's hard for them to kind of move around and stuff, because then they probably just need to rest. I think really bad coughing, things like that, I would definitely keep your kid home, and then check with your school as well. Congestion alone is the one time where it's like, well, maybe you could send them in, maybe not. But I think if you want to be safe, it's always better to get a COVID test first before you send them in. Kate, are there specific, like, you know, things to add to that?
I think a lot of the schools have had, you know, they'll sort of share a screener, right? If your child has temperature, you know, runny nose, X, Y, or Z, please keep them at home. And what I've observed from being in the schools so far this year is that educators and administrators and school nurses are more likely to send their kid to the nurse to have a screen and to potentially send them home for an illness that maybe they would not have otherwise gone home for, as a precaution, and are often requesting that families either get a COVID test or quarantine before the child returns to, you know, avoid that outbreak. Because even with mitigation strategies, especially in the elementary schools where we don't have the vaccine yet available for kids, and that, you know, it's maybe not always possible to not be within closer proximity. I think schools are making every effort to keep kids safe, and part of that is sending them home, requiring a negative COVID test, and then or asking them to quarantine. So that's really what I've observed, is just seeing more kids that probably otherwise would have been given, you know, a Kleenex or something and sent back to class, are now being sent home. Next question is, and I'll take these last. Sorry, go ahead.
Just real quick, we talked about this earlier, and I thought it was really important. So if you missed it, if someone does not have symptoms, but they had an exposure that they're worried about, the best time to get a test is about 5 days after that exposure. But that's, again, for someone that doesn't have symptoms and was exposed either at home or at school.
Thank you. And then how long do the antibodies stay in the system after somebody has COVID?
I think about 3 to 5 months. I think this is a moving target, and it's really hard to say what role they're playing or how much protection they're offering, but we are still able to measure them on the order of months after infection.
Thank you. And Jabreen, did you have another question or just that one?
Just that one in the chat. I just put it in the chat.
Thank you. And then the last question from Alejandra are, is it enough to eat healthy to have the immune system to fight COVID? And can you please, again, mention mitigation strategies that work?
Yeah, that's a great question. So eating healthy is great. I mean, you know, I'm all for that, but it's not enough to fight COVID. I think the issue is that our bodies can fight COVID, but oftentimes not without getting very, very sick. And what the vaccine does, like I said, is a body's immune system has all kinds of different levels to it, but one of the most important levels are things called antibodies. And what antibodies do is they are a specialized defense system. So if you have a specific virus that enters your body, you have antibodies against it. Before your body can get sick, the antibodies are like, oh, I see that virus and I'm gonna go ahead and kill it. And what the vaccine does is it creates those antibodies so that if COVID ever enters your body, that the antibody goes and says, oh, I see that COVID, I'm just gonna go kill it before you can get sick. Now it doesn't work, nothing is 100%, but it's very effective, like very, very, very effective in doing that. And so eating healthy is great, but it doesn't create those antibodies against COVID the same way the vaccine does. And so, did that answer your question, Alejandra? Or Jonathan, do you have anything else to add to that?
Not really. Maybe just to advocate for good sleep. I think in addition to healthy diet, eating foods of a lot of different colors, and I think getting good sleep for grown-ups and kids is important for promoting good immune function.
Yeah, I think it's I believe in the community. I'm just mainly voicing people here, and they say, well, I eat well, and I, yeah. So kind of like for some people, they think that if they eat well, they haven't mentioned anything about the sleep. So this is something new. It could be sufficient, and kind of like in that line, how important is prevention, because I understand that like there are different levels of like getting sick with COVID. So if you get the, as Dr. Maya was saying, if you get the chance to get vaccinated, vaccinate, so you can like fight that virus. And I don't know, I wanted to hear about prevention also.
If you feel comfortable pushing back, I would actually characterize nutrition and sleep as necessary, but not sufficient. So if some of your community members are saying, oh, this is enough, I would push back on that respectfully. I think in addition to eating right, getting exercise, getting rest, for me, it's really three things. It's being vaccinated, wearing masks, and then physical distancing where possible. I think adding those to the foundation of exercise and sleep and nutrition is much better.
Yeah, I totally agree. I mean, I'm all for exercise and sleep if you can, when you can, and nutrition, but that doesn't create antibodies against COVID the way a vaccine does. And the other thing that I just want to mention is vaccines are prevention. You know, vaccines are prevention. Vaccines prevent you from getting diseases. That's why I was saying, that's why we don't see polio or we don't see tetanus, you know, in very often here, is because vaccines are critical for prevention. And as a pediatrician, I mean, most of what I do is prevention. I mean, that's why I love being a pediatrician. I love supporting children and families in preventing illness and promoting healthy life, you know, them to be healthy and well for their whole life. And vaccines are like a cornerstone of prevention. And so just like eating healthy helps you prevent, you know, helps you prevent against heart problems and other things, vaccines help you prevent against measles, against tetanus, against COVID. And so I guess, Alejandra, I know you are like an amazing advocate in every way, so I'm sure you're doing this already, but yeah, just vaccines are part of prevention. They really are.
Thank you all so very much for.
Can I ask, okay, so why does when
Jareen, go ahead, and I think where you need to end it, but thank you. If you just want to have one more question, absolutely, go ahead.
No, I was saying thank you.
Oh, sorry. Thank you all. Well, thank you for being here. And thank you all so very much for your time and your thoughtful questions today. And just thank you to Dr. Maya and Dr. Jonathan for all of your insight. I know this is, you know, it's a lot, and especially for younger kids or folks who have families. So just really appreciate you all taking the time and interest in this really important public health initiative. So thank you all so much. And we just want to let you know too that the Pittsburgh Learning Collaborative is 8+ schools, along with other partners, have our Family Hotline, and we'll be sending out information to you all on that. And if you have COVID questions, you can also call in there as well. And we'll do our best to continue to put information out to keep you all informed, especially as the 5 to 11 rollout begins, hopefully in the coming months here. So thank you all again so very much. And I just really appreciate your time. Thank you. Have a good night, everyone.
Bye. Thanks, everyone. Have a good night.
See you. Thank you.
Thanks, everybody.
Thank you. Good night.